Hello everyone, I'm Dr. Sandra Lee, and today I want to share something you might not think about every day: your eyebrows and eyelashes. These small features play a surprisingly big role in our daily lives, far beyond just looking good or following beauty trends. Eyebrows and eyelashes do more than frame our faces. They serve as our eyes' first line of defense against the outside world. For example, eyebrows act as natural shields, catching sweat, rain, and even small particles, then directing them away from our eyes so our vision stays clear. They also help block out bright sunlight, almost like a built-in sun visor, reducing glare and making it easier to see on bright days. Eyelashes, on the other hand, are our eyes' personal gatekeepers. They catch dust, pollen, and other tiny debris before it can reach the sensitive surface of our eyes, and they trigger a blink reflex to protect us instantly. But that's not all. Our brows and lashes are also key to how we communicate. They help us express emotions like surprise, happiness, or concern, and they play a big part in defining our unique appearance. When we lose our brows or lashes, it's not just a cosmetic issue. It can actually make our eyes more vulnerable to irritation, dryness, and even infection. That's why it's so important to pay attention to their health and notice any changes, like thinning or loss, as these can sometimes signal underlying health concerns. If you spot changes, don't ignore them. Your brows and lashes are telling you something about your overall well-being. Healthy, full brows and lashes help keep our vision sharp and our eyes comfortable, acting as a daily barrier against the elements. In the next chapter, we'll dive into what causes changes in your brows and lashes, and I'll share tips on how to keep them healthy and strong. Stay tuned. Losing eyebrow or eyelash hair, known medically as matarosis, can be distressing at any age, and it often comes as a surprise. Our brows and lashes are more than just facial features. They play a big role in how we express ourselves and how we feel about our appearance. You might notice your brows looking thinner, your lashes appearing shorter, or even find stray hairs on your pillow or makeup pad after your daily routine. These subtle changes can be easy to overlook at first, but over time, they can become more noticeable. This loss can impact your confidence and self-esteem, since brows and lashes frame your eyes, highlight your expressions, and shape your overall look. For many, these changes can lead to feelings of self-consciousness or frustration. It's important to remember that hair everywhere on our bodies, including eyebrows and eyelashes, goes through natural cycles of growth, rest, and shedding. This process is completely normal and happens to everyone. While it's normal to lose a few hairs each day, rapid thinning, sudden bald patches, or a dramatic change in density can signal an underlying problem that needs attention. The good news is that, in many cases, the hair follicles are still alive but simply dormant. This means there's often potential for regrowth if the right steps are taken. Addressing the root cause, whether it's a skin condition, a health issue, stress, or even certain lifestyle factors, can help stimulate hair regrowth and restore your brows and lashes over time. Most cases of eyebrow and eyelash loss aren't permanent, but patience is key. Regrowth can take weeks or even months, so it's important to be gentle with yourself and your routine. If you notice changes, don't ignore them. Early action can make a big difference in preventing further loss and supporting healthy regrowth. Understanding the hair growth cycle and what's normal for you helps you take action early and seek help if needed. You're not alone. Many people experience eyebrow or eyelash thinning at some point in their lives, and support is available. Let's take a closer look at what might be causing your eyebrow or eyelash loss, and how you can start your journey toward healthier, fuller brows and lashes. There are a variety of reasons why your eyebrows and eyelashes might start to thin, and understanding these causes is the first step toward addressing the issue. While some people may notice gradual thinning over time, others might experience sudden or patchy loss. Both can be distressing, but knowing what's behind the changes can help you take action. Skin conditions like eczema or psoriasis can inflame the delicate skin around your brows and lashes, leading to irritation and damaging the hair follicles. This inflammation can make it difficult for new hairs to grow, resulting in noticeable thinning or bald patches. Autoimmune diseases, such as alopecia areata, can also play a significant role. In these cases, the body's immune system mistakenly attacks healthy hair follicles, causing patchy or even complete hair loss in the brows and lashes. This can happen suddenly and may be accompanied by hair loss elsewhere on the body. Thyroid disorders, whether the gland is underactive or overactive, often disrupt the normal hair growth cycle. This is especially noticeable at the outer edges of the eyebrows, where thinning is a common early sign. Thyroid imbalances can also affect the lashes, making them appear sparser or more brittle. Certain medications, including chemotherapy drugs, blood thinners, and some antidepressants, may cause thinning as a side effect. These treatments can interrupt the hair growth cycle or weaken the follicles, leading to temporary or sometimes longer-lasting hair loss in both brows and lashes. Stress and aging are also important factors. Chronic stress can push hair follicles into a resting phase, slowing regrowth and making shedding more noticeable. As we age, our hair naturally becomes finer and grows more slowly, which can make thinning more apparent over time. High levels of cortisol, the stress hormone, can accelerate hair shedding, while the natural aging process gradually reduces the density and thickness of both brows and lashes. These changes are common, but they can still be concerning. If you notice changes in your brows or lashes after starting a new medication, experiencing a stressful period, or as you get older, it's important to pay attention and keep track of these changes. Documenting when and how the thinning occurs can help your healthcare provider identify the underlying cause. Ultimately, identifying the specific cause of your brow and lash thinning is the first step toward finding an effective solution and restoring your confidence. Early detection is key. Watch for increased shedding, more hairs on your pillow, or when washing your face. Notice if brows or lashes look finer, shorter, or less dense. Visible thinning, gaps, or patchy areas are clear warning signs. The outer third of the brow is often first to thin, especially with thyroid issues. Check the skin underneath for redness, scaling, or irritation. These can signal underlying skin problems. Healthy skin is essential for healthy hair. If you spot these changes, act early. Early action can prevent further loss. Gentle care goes a long way. Remove makeup with a soft touch. Use oil-based removers and avoid rubbing. Don't rub your eyes or overuse eyelash curlers. Keep tools clean and use them carefully. Avoid overplucking or waxing brows to prevent permanent follicle damage. Eat a balanced diet rich in biotin, iron, zinc, and vitamins C, E, and D. Stay hydrated. Healthy skin and hair start from within. Consider nourishing serums with peptides or biotin, and try castor or vitamin E oil after a patch test. Address allergies with proper treatment to avoid rubbing. Small daily habits can make a big difference. Consistency is key for healthy brows and lashes. If home care isn't enough, medical treatments can help. Dermatologists may prescribe topical steroids for inflammation or corticosteroid injections for autoimmune causes. For eyelash loss, Latisse, bimatoprost, can lengthen and thicken lashes, applied nightly to the upper lash line. Minoxidil, known for scalp hair loss, is sometimes used off-label for brows under medical supervision. These treatments target the root cause and can stimulate regrowth. Always use prescription products as directed to avoid side effects. Your doctor will guide you on the safest, most effective options. Results take time, so patience is important. Professional help can make a real difference. Sometimes, it's time to see a doctor. Sudden, rapid, or patchy hair loss needs medical attention. It could signal an underlying condition. If you have redness, pain, or other symptoms like fatigue or weight changes, get checked for systemic issues like thyroid disease. No improvement after months of home care? See a dermatologist. They may examine your skin, run blood tests, and pinpoint the cause. Don't manage this alone. Support and treatment are available. Early diagnosis leads to better outcomes. There's hope for fuller, healthier brows and lashes.